Okay, let's try this again. We had some technical issues earlier, but we are really cutting into your programming this time to bring you a special report as the governor gives his weekly update on the coronavirus in Louisiana. I see he's at the podium. Let's listen in.
Looking at as we determine our next steps, which we will do over the next several days. But just wanted to give everybody a peek at what we're looking at currently. We also have Karen Stubbs, who is the Assistant Secretary for the Office of Behavioral Health. And she's going to update us on a new recovery hotline. As those of you who pay attention every day anyway are likely to have noticed, the Department of Health did not update the COVID-19 dashboard today. We expect that we'll get back to the update tomorrow, which will include today's numbers and tomorrow's numbers. But the Department of Health wanted to review the data to make sure it was accurate and in specific, and I think Alex can speak more about this when he's up here, especially if you have a question, trying to make sure there are no duplicative or non-Louisiana residents whose tests may have been done in Louisiana and they're being included in our dashboard so that we get the right results on the dashboard. As always, they're working to improve the management of the large volume of data that it receives and in order to remove duplicate tests and cases and ensure assigned to the correct home parishes and provide the most accurate data for the public. And also for me to understand what's going on with respect to the pandemic. Because the very same data that you all see as the public is the data that we make our decisions on going forward. The continuous improvements are important because we need that sound information on cases and tests in order to direct our targeted testing and contact tracing efforts. And while the Office of Public Health team continues to work around the clock to report the most accurate available data on the epidemic, it doesn't always fit neatly into a 24-hour cycle. So we apologize that we don't have that information for you today. Again, we available tomorrow. The one number that I can give you today is on deaths, and that's because we get that information from a different source. There are 7 new deaths since yesterday, which is, historically speaking, a low number. And of course, if that's a relative or a friend, it's every bit as significant as if it were a large number, and certainly we grieve everyone. But we're reporting 7 new deaths, and the total deaths now is 2,957. Even though we don't have today's numbers to share, I do have some information I want to share about trends, things that we are starting to see. And as I mentioned to you the other day, we're starting to see some things that are concerning, and so we want to disclose that as soon as possible. We last spoke June the 10th. Since that time, and even not counting any numbers from today, and there was a couple days where we reported cases that were actually several weeks old. If you take out all the backlog cases, since June 10th, we've added more than 4,200 new COVID-19 cases across the state. That's in 7 days. Most of these cases did not come from nursing homes or other things. And so what that means is they were the result of community spread. I point this out because there's a lot of talk in our state and nationally about a second wave coming in the fall. I guess that might happen, but right now, today, we need to know we're still very much in the first wave. Coronavirus hasn't left. It is still very much here with us, and it is present in every community across the state of Louisiana. And the reality is, based on these trends that we're seeing, every Louisianan needs to do a real gut check on whether he or she has been slacking off when it comes to taking the proper precautions. I know that we've been delivering the same message over and over for the past few months, and a lot of times when you do that, you run the risk that it just becomes so commonplace that people aren't paying attention to it anymore. But the simple fact of the matter is, we need people to wear their masks, wash their hands, practice social distancing, stay home when they are sick. Those things are every bit as important today as they were at the height of this pandemic, when we had the highest growth rate anywhere in the country or anywhere in the world. And flattening the curve isn't something you just do once and forget about it because it's over, because we still have the disease. It is still contagious. It is still deadly. We can easily see the gains that we've made evaporate, and that's why we always have to be vigilant and take the necessary precautions to protect ourselves and our loved ones, especially those who are most vulnerable. Just because more places are open doesn't mean we need to go everywhere that we can. Consider how often you need to leave your home. This may not be popular to say, but if you get to a place and you have too many people in too close proximity to one another and folks aren't wearing masks, especially the employees and so forth of that business, go somewhere else. Don't go in. You can choose to do the right thing for yourself and your family and ultimately for the entire community. You have the power to slow the spread of COVID in Louisiana. And I know that is true, and you know that is true because we've done it before. The numbers that we've been seeing over the last several days prove that we just can't afford to become complacent. There are several regions of the state now that have developed into areas of real concern. And it illustrates the point that the situation changes when our behavior changes, and that's for good or for ill. That's what happens. Complying with the mitigation measures absolutely makes a big difference. And I know that everybody is concerned about what's going to happen in August or what's going to happen in December or whatever. And I know that it's disconcerting that we don't have the predictability that we're used to. Certainly we don't have the certainty that we're used to. But the best tool that we have for making sure that we can do things later this year is doing what we need to do today. And one of the reasons that we wanted to come out today and deliver this message is if we're seeing test results that are indicating more positives, if we're seeing more hospitalizations, these things relate back to activity that happened 2 weeks ago or longer. And so there literally is not very much at all that we can do that's going to affect whatever's going to happen over the next 2 weeks. But we better get ahead of it and start thinking about, okay, well, what can we do to make sure that on the 15th day and on the 16th day we are moving in the right direction. And some people want to pin cases and the growth in cases on specific holidays, whether it was Memorial Day or... The truth is, we, like the rest of the country, we have eased restrictions. We have more businesses open. We have more employees back at work. We have more customers going into these places. People are coming into contact with one another much more frequently. And I am absolutely convinced, by the way, all of that can happen without cases spiking so long as you do it in the way that we've set forth here in the state of Louisiana with the restrictions that we have. These occupancy limitations, the distancing that we're asking people to do, to wear your mask, to stay home when you're sick. If we do these things, we can ease restrictions and not have cases spike. But it's up to all of us. And yes, it is true. We are testing a lot more people. As you know, we have a goal to test 4.3% of our population each month. That's 200,000 people. Without any tests today, I know that we're already at about 160,000 tested in the month of June. So we're way ahead of where we've ever been thus far in the number of tests that we're administering. And so you would expect to see more positive cases, but we're seeing more positive cases than just the increase in testing would suggest we should. And certainly we are seeing more people in the hospital in several regions. So at the end of the day, we all need to take personal responsibility for ourselves. And that's both as it relates to contracting the disease and as it relates to possibly spreading the disease. Take responsibility for yourself. So I'll say it again. Everyone needs to continue practicing the mitigation efforts that we know that work. Wear a mask or facial covering, social distancing, frequent hand washing, stay home when you're sick. And the most vulnerable members of our community should know they are always safer at home. And they should limit their outings, and they should never get into large groups of people. And these are those who are 65 and older with underlying health conditions. Did want to give you all an update on nursing homes in particular. At this point, LDH has conducted 535 on-site or virtual infection control assessment and response, we call them ICAR, visits to facilities across the state. ICAR is a tool to assess infection prevention practices and guide quality improvement activities related to infectious diseases. To date, 82% of all nursing home residents and 68% of all nursing home staff have been tested. Health Standards has distributed a letter to all nursing home facilities addressing COVID-19 testing requirements at all facilities in Louisiana and outlining the policy requirements of LDH and the Louisiana Medicaid program for nursing facilities, administrators, and owners regarding COVID-19 testing of residents and staff and healthcare professionals. Each facility shall conduct the baseline initial testing of all residents and staff by June 30th, 2020. Most have already done that. Further, each facility shall conduct the first weekly testing of all prior negatives and untested residents and staff no later than July 14th. Such weekly testing shall continue until there are no new cases over a 14-day period. Now, at this time, I'm going to ask Dr. Bu to come up and walk us through the gating criteria. So he's got some slides to show you on the trends that we're seeing as it relates to the COVID-like illnesses, cases, hospitalizations, and so forth. If you've got questions for him, I would ask you to go ahead and ask him the questions while he's at the podium. He will then be followed by not Dr. Stubbs, Karen Stubbs, to share important information on a new recovery hotline that's available to better, so that people can better cope with what can be a very stressful time. And then I will come back after Karen Stubbs and take your question. Dr. Bu?
Thank you, Governor. So thank you all. You know, as the Governor noted, we obviously have been releasing data on a daily basis, people watching the dashboard, seeing cases increase, watching the hospitalization numbers increase where there had been steady downtrends. So we wanted to take the opportunity to look through at the gating criteria and also put that in a context where we know that nationally there's a lot of discussion about a variety, many states that are seeing rises in cases and hospitalizations, including our neighboring states. We're seeing spikes certainly in Texas, Arkansas, even Mississippi, and so we wanted to share with everybody what we're seeing. And maybe we'll start with the first slide. These are images from data compiled by the Centers for Disease Control. And this is just to convey how they think about whether the number of new cases that an area is seeing are high, moderate high, or low. And the deeper the purple in these slides, the higher the incidence or number of new cases on a regular basis is. And so what I think is pretty clear from looking at a map like this, and this is the way the CDC sees the world, is that there's significant portions, in fact, the entire sort of middle section of our state, north and south, that still has a high number of new cases being reported every day. So as we see improvements in number of cases reported or numbers changing around, the baseline is still what we've said previously, that we still have literally thousands, nearly 10,000 cases that we think are active just based on the data that we have. And that means all of those are potential opportunities for an individual to spread to another individual who has not yet been infected. And when we look down to the parish level, you can see that it's pretty diffusely spread where we're seeing this significant level of new cases each day. So next, I'm going to show you some graphs that look more like what you've seen before. These are our gating criteria. I know we've shown these on several occasions now, but I'll still orient you so you understand what we're looking at, and this will help us sort of move through the other regions as well. If we start at the upper left-hand corner, there's that sort of very craggy graph. And that's showing COVID-like illness. So this is what we call syndromic surveillance. These are people, again, who are showing up into the emergency department with symptoms of COVID. Classically, we talk about fever, cough, shortness of breath, but we've added to that through the CDC, sore throat, congestion, loss of smell or taste, upset stomach, diarrhea, and those kinds of symptoms, shaking, chills. People who show up with those symptoms could have COVID, they could not have COVID. It remains to be seen, and those people need to be tested. And so as people are tested, then if they're a case, they'll show up in that next graph on the left. That's the epi curve. That's the number of new cases being reported each day. And certainly you can see, and we've shown this before, that we had this sort of very steep rise, then a nice decline, and then most recently what looked like a rolling plateau. And we've previously talked about that rolling plateau also happening at the same time that we were increasing the total number of tests. If you look at the upper right-hand corner, that purple line is what I'm describing with the total number of tests. So if you can think about those two graphs together, as you're seeing that purple line increase, you're seeing that overall cases were staying relatively stable for a while. And again, we talked about how without seeing that impacting hospitalizations, that generally means we're doing a better job of finding the COVID in our community. We are testing more people. We're getting out there, testing the Latinx population, testing people in African American communities, testing people in congregate settings, finding the COVID that was hidden. More recently, however, you see that there's, after the surge in tests, a slight decrease, probably coming down to a new normal for the level of testing. And that slight decrease in testing is happening at the same time that statewide we're seeing an increase in cases. And that's concerning, because that shows us that, to the governor's point, what we're seeing is not just cases as a result of new tests. What we're seeing is a number of new cases that are increasing statewide. The last graph down on the lower right-hand corner is our hospitalizations curve. And if you look at the trend there, the last 14 days are highlighted in yellow. We're still seeing that is continuing to come down. However, if you look at the very tail of that trend, you see that slight, almost like a ski jump, that slight uptick. So certainly we would describe this as a 14-day downward trend. What we're concerned about is a trend in the opposite direction has to start somewhere, and we're beginning to see the signs that maybe we're seeing that uptick. So again, that's the state level data, and what we've been doing and continue to do is drill down to the regional level and see, well, what's kind of driving these trends. So we'll look at Region 1. Here you see when you look at symptoms of COVID generally coming down nicely. Most recently we had a little bit of a spike showing increased presentations to our emergency departments with symptoms of COVID. When we look at cases, again, you see a really dramatic decline after that initial slope, plateauing out, but again, the most recent nearly week there showing signs of increasing cases. Again, that sort of uptake on a ski jump. Testing surged and has been relatively stable, again, probably coming down to a new normal. And hospitalizations, again, continue to decrease, and except for really the last recent days, really the beginning of the weekend through till about now, seeing a little bit of, again, an uptick there at the end. So again, the trend in hospitalizations is down, but we're concerned about the very end of that trend, and is that the beginning of a new trend that we'll be talking about going forward. Region 2, and I should orient you, Region 1 is the greater New Orleans area. Region 2 is the capital area, greater Baton Rouge and associated capital area. Here, fewer emergency department visits in general than, say, Region 1, so the data is a little bit jumpier on symptoms, but coming down. When we look at the cases, we see that the cases, by and large, are coming down, though the very last bit, a little bit of an uptake. So what we hope is that we continue to see that over time that takes a downtick, and it's this undulating pattern that continues, and that's not an uptick that then continues to rise. Tests increasing and hospitalizations going down, except for, again, right at the end there's a little uptick. And it's a pattern that we're seeing now in a couple of regions. We'll go to Region 3. Region 3 looks very similar. Rising cases right at the end, slight uptick in hospitalizations right at the end. So right now, that data, again, I would still classify hospitalizations as over 14 days decreasing. What I'm concerned about is the last couple of days. The regions we're going to show you now are real concerns because here there's a clear trend of increase. So we'll start with the Acadiana region, Region 4. And Region 4 has shown a very alarming rise in new cases. It was showing essentially nearly like a plateau, I think, the last time we showed you the data. And now you can see a pretty steep rise in cases. Some of that's even being reflected in our syndromes. You see a slight uptick in that upper left-hand graph. Meanwhile, testing has dipped down, and a lot of that testing dip down was reflective of a decrease in testing with having to shut down testing sites thanks to Tropical Storm Cristobal. So I would expect that we'll see that kind of come back up. But regardless, even though testing was coming down, cases were spiking significantly, and the hospital trend is enough that the last week of hospitalizations have reversed the decrease that we were seeing in Region 4, and we're now seeing an increase in hospitalizations in Region 4. Region 5 was one of the regions we previously highlighted as a concern, and here that trend has continued. So rising cases continue with a very steep incline really over the last 2 weeks now when that data is put together, and the hospitalizations taking the same steep incline. So we've talked a lot about what if we just see a rise in cases? Is that enough for us to be concerned? And we said, no, we need to look at what's going on with tests, and we need to look at what's going on with hospitalizations. Well, this is that case where you see an increase in cases and you see an increase in tests, just like in Region 4. That tells us there is actual spread that's going on in those communities. We look at Region 6. Region 6 has had a longer but consistent incline in cases. Testing has also been improving. And here you see now still over the 14-day period, that U-shaped trend on average is still going down. However, I think it's lost on nobody that if we keep walking out the last week or so of that increase in hospitalizations, that slope will change, and we'll see that is also going to see an increase in hospitalizations overall. So that gives us Regions 4, 5, and 6, really the diagonal swath in the middle of the state, showing an increase in cases and hospitalizations that's concerning. We do have some heartening news. Region 7 previously had been a region at the very beginning of May that we were concerned about with the number of cases it was seeing and hospitalizations going in the wrong direction. We still have seen a slow decline in cases despite increasing testing, and a slow decline in hospitalizations. And we just need that to continue. We need people to keep doing the great work that they're doing up there, keep separate, keep wearing masks so that we can have that trend continue. We also have a good news story in Region 8, where we've been raising alarms really since the beginning of May as well, where we saw a persistent increase in cases and in hospitalizations. And what we've seen, at least in the most recent trend for cases, is that there is an actual decline for new cases in Region 8, and that's having an impact on hospitalizations. Where we had previously shown you it was plateauing, now there's a dip down, and we hope that continues as well. Again, we want to learn more about the kinds of behaviors that are going on in Region 7 and 8, and really see if we can spread that kind of message and leadership to the rest of the state. We'll go to Region 9. So Region 9 being so close, this is the area of the North Shore and the Florida parishes, very close to Region 1, to the greater New Orleans area. So the trend that we see in New Orleans and in Region 3 is kind of reflected here in Region 9. A slight uptick in cases most recently, certainly in the last week. And then hospitalizations on a downtrend, but with a rising trend most recently. Not a very steep one like we saw in Regions 4, 5, and 6, but certainly not something that we would want to continue to see going forward. So I think, before I go further, and I know I've shown you a lot of data, I do think it's worth taking a step back and thinking about where we are as a state. And if we go to Region 1, I don't know if it's possible to go back to Region 1, I think there's been a lot of news articles written that look at the epi curves across the United States. And what always strikes me about the epi curve for Louisiana is that we have this really dramatic rise and this really dramatic fall. And that is the work of the Louisiana people. That is people taking to heart the advice that you were getting from public health officials, from the governor, the stay-at-home order, and had a turnaround story like almost nowhere else in the country. And if you go to New York Times or any of these websites that plot these out, you won't see too many graphs that look like ours. So we know how to do this. We know how to do the work of putting on masks, of keeping separate from each other. We, to the governor's point, I think know a way that we can re-engage with each other, but do it in a way that's common sense and that really is thinking about how we protect each other. And that means staying more than 6 feet away from people, even if you're wearing a mask. That means wearing a mask, even if you're outside. That really means, and around other people that are not in your household. That means being cognizant of the surroundings that you're walking into. And if it is a restaurant that's open and not exceeding their 50% capacity, but nobody's wearing a mask, or they're trying to seat you next to somebody who's a group that's not wearing a mask, walk with, use your feet and get out of there. I mean, this is you. This is your health at risk. And really want people to be thinking about their individual power to change this dynamic and their individual risk. We talked last week about how we put a screening tool on the LDH website. We've had over 1,000 people use the self-risk assessment to understand what kind of health concerns do I have that I should be worried about, getting COVID, and think about my risk for COVID and how much I should engage. There's a second part to that risk tool, which is also, well, where do you work and what do you do and where do you go out? And that's the two things you need to be thinking about when you're assessing your risk. Who am I, but also what am I doing? What are the actions I'm taking? And you have a lot more control over that second set of actions. So encourage people to go and use that tool to understand how things can be managed themselves. But again, we have done tremendous work as a state to be able to come back down to that kind of level after having that level of rise. And so what I'm trying to convey to you today is not a naming and shaming. It's that we're seeing a rate of rise that in 2 weeks could make us look like Texas or could make us look like Mississippi or Arkansas. And right now, we need to act to make sure that we do what we did early on and reverse those trends, and that's by being good neighbors to each other. I want to leave with you just a little bit of data at the end to talk about the other work that we're doing as a state to support you in that, and that's contact tracing. As you know, we've been working with every case that comes in, trying to reach out to everybody and trying to do that in a timely fashion. Here you see two different speedometer-style graphs showing you how we're doing in reaching folks in a matter of time. So on the far left, the far left are the cases, and on the right are the contacts. And what you see is, it takes us on average a little under 60 hours between the time of knowing about a case and getting in contact with them. That's not because we're not reaching out immediately. It's because often we're calling, the first call's not answered, maybe people have to call us back. We want to get that number down. We want to be in the green zone and certainly reaching folks within 24 hours. Here it's taking us nearly 3 days to really make that connection with people. On average, for the contacts that we've been able to get information on, we're at about 37 hours, so much better in closing the loop on those contacts. Once we actually get in touch with people, the rest of the process seems to be going faster, and our goal there is to be 48 hours or less. So we're heartened by that. And on the next slide, you'll see some data with a bunch of numbers that you probably can't necessarily read, but I think the basic point that I'll make here is of the cases that we have contact information for, we're able to attempt contact on 97% of them and really reaching out and engaging the majority of those folks. We're able to reach about 57% of the cases, again, calling, maybe people aren't answering the LDH number or for whatever reason aren't really picking up. And we're continuing to, as you see, attempt to reach out to folks. A small number of people, about 4% and 4 to 5% between cases and contacts when we reach out, say they don't want to participate. And on one level, I'm heartened that it's such a small percentage. It's only 4 to 5%. On the other level, I would just ask that 4 to 5% to really think about what we're trying to do with this call is give you information. What we're trying to do is help you understand how to protect yourself by understanding the symptoms to look out for, how to protect your family by staying isolated from them, how to protect your community, your neighbors, your loved ones, the people across the state that don't need to get COVID and don't need to die. And we give you that information as well as support. We give you resources. For most people, it's masks and cleaning supplies, but it can go up to help with grocery delivery, with prescription delivery, things that are going to help you be successful in staying home. It seems at a time like this, when people have been home so much, that being asked to stay home for 14 days is a huge ask. But if you put it in the grand scheme of things, staying home, letting things run their course, if you're a contact, staying home even though you feel well for that 14 days can mean the difference between that rising level of rise that we saw at the beginning of this epidemic and where we've been up to this point with continued cases and hospitalizations going down and putting us in the best position to avoid a wave in fall. What we do now in the summer is going to really tell what kind of position we're in as we enter the fall. And so that's all within our power. So I know there's a lot of data, but wanted to share all of that with you. And happy to take questions at this time. Melinda.
In terms of what is driving the increases, is it entirely people just being off their guard? Can the protests that have been happening around the state have something to do with the increases? Is it, I mean, what are y'all pinpointing as the driving factors to all of this?
So through the data that we get through contact tracing, through knowing where the tests are coming from, we try to answer that question every day. We want to see where can we intervene, what can we do. Pretty consistently now what we've seen is that most of the new cases, rather a very small number of the new cases, only 9% on average, are coming from congregate settings, are coming from the nursing homes, these other sort of close living conditions where people are in close contact. So nearly, a little over 91% or 90% are coming from the general community. And then when we look to try to understand, are there hotspots that we can come back to? There are occasional times where we'll find, again, we talked about it before, small clusters, 5 people who got together, even though they are not in the same household, got together in a single house and didn't wear masks. That doesn't count as a household. Sometimes associated with going out to a specific event. Your question about protests, we certainly are hearing as we reach out to folks, some people who say, well, that was the first time I really left my house and now I've got COVID, so maybe there's an association there, but it's not a significant trend in what we're seeing here. And as we've said from the beginning, people have to weigh the importance of expressing themselves and raising concerns about the health effects, the deadly effects of racism, and protecting from COVID. And I think especially if these protests are done outside, there's a way to do both, by wearing a mask, by keeping distant from each other by more than 6 feet. And so right now we're not seeing that in our data. What we're seeing in regions 4, 5, and 6, remember, is 2 weeks in the past in its effects. And the same goes for even what we're seeing in other regions. Sam.
More about why you guys didn't report data today, and especially now, considering we are seeing these rising cases.
Sure.
More interested right now, and then suddenly we don't have data. The decision not to report data.
Yeah, well, so fundamentally, and even going back to the very beginning of when we stood up a dashboard and reported data, one of the most important things for us was giving you the most accurate and reliable data as far as we knew at that time. And so the other thing that we've been doing since that time is continuing to update the way that we clean the data, look at the data. Most recently, we've been trying to really reduce the number of individuals where we don't have good address data for them. We made a move back at the end of April so that tests that were reported that were not associated with a case went back to the parish of origin. That was the move that we need to make in order to support contact tracing, because we need to be able to say where's the testing happening so we can go back there. But that relied on the address data that we get through the tests and largely on their zip code. Our team has been building a way of getting more accurate address data. It's a process called geocoding, which I won't go into, but it gives us a much more accurate answer as to where is that person actually located, where is that parish supposed to be associated. So they've been working on the algorithm. We've been trying to then build that into the data. But as the governor said, sometimes as you're working out those kinks, it's not something that you can solve in a 24-hour period when you're going live. And so rather than put up partial data or data that were put up and have to walk back the next day, we wanted to get it right before we put it up. And so again, we believe that we'll be able to put that data up tomorrow. Understand that it's frustrating for everybody who's watching so closely the numbers, but would be more frustrating for me, and I think for all of you, is if we put up numbers that we know that we're going to have to change the next day because the algorithm just wasn't quite, the way of assigning those tests just wasn't quite right yet.
Can I ask on that point?
Please.
There have been several instances recently where there are numbers that contain testing catalogs. I I guess I thought a month ago, y'all had said you thought you got through all of that and you weren't expecting any large backlogs, but it seems like we keep having them. So where
Yeah.
are those coming from?
So I don't know that we ever said that. I think we might have said the major people. So for instance, there were large-scale labs, research labs like LSU Vet School and others that had come online. And when we got those large-scale labs, LSU Shreveport as well, I think that's where we're saying, look, the big labs that are reporting, we're bringing inside. There are still clinics that are buying machines that are point-of-care tests. There's now at least 4 different point-of-care tests on the market. And so those continue to come online in clinics all the time, and they are not usually familiar with the electronic lab reporting required for this. So as a new tester comes on board, we try to get those tests in. And then, again, even the people who have established electronic lab reporting, at times, they have issues on their side, and then they reach out to us and say, hey, look, we found there was a glitch in our system and a backlog. So, earlier this week we had a lab that reported a specific segment between April 10th and April 20th that they had an issue with reporting previously, and so we brought those in. The news that I can give to you and reassure the public is that when we get that data in, we do not assign it to the date that it reaches us. We go back and look when were those specimens collected, and we assign them back. So the epi curve that you're seeing here is not impacted by those backlog of tests. People are reassigned back into the epi curves where those tests took place.
Going back to with your presentation as we entered phase 2, you spoke at length about how bars might not be the safest place, looking at data from other parts of the world that open bars, and then go back and close them. We're now hearing from patrons and employees at local bars that they have tested positive for COVID-19. Obviously, not they got it directly from there, but as more people come forward. Now in the middle of phase 2, kind of talk about LDH's assessment of bars, where we're at with that, and if they still pose an increased threat as opposed to other places of business.
So, I mean, again, I'll emphasize any place can pose a potential threat if what we don't do is adhere to staying 6 feet away, wearing a mask. Even then, we are not able, right now, through masks, through social distancing, to get any risk of COVID spread to 0. We're talking about trying to get rid of the majority of the risk so that the chances are low. But the chances are there any time you're going to come in contact with another person. The only way to be safe would be for all of us to put ourselves in our homes and not interact with anybody. That's not workable. So what we have to do, though, is as we're engaging in any sector, we need the employees wearing masks, keeping 6-foot distance. We need patrons wearing masks and keeping 6-foot distance. We need everybody being vigilant of their surroundings and trying to make sure that they're staying apart from each other. Bars have certainly raised a concern internationally. We've seen places like South Korea and Germany, after they've unlocked and unrolled those or relaxed those restrictions on bars, have to walk them back because those in particular were places where they found hotspots associated. We're watching that data very closely because we certainly don't want to have a rise in cases because of a single specific sector. What can be done in addition to just us looking at that data is bar owners being very serious about masking, about distancing, and about recommending or requiring, which is their right, that anybody that comes into their bar wears a mask while they're in the bar. And, you have to take it down to take a drink, but I think we'd rather that than a situation where my place of business is contributing to the spread of COVID. Other questions? Melinda.
On the nursing home testing information that the government talked about, so now nursing home testing is mandatory. Y'all are going to require all nursing homes to do the testing, is that right?
I might turn it over to Dr. Guidry, the state health officer, to answer that.
I heard a woman say in the news over the weekend that as she got older, she looks better with a mask on. Never more true than dealing with coronavirus, right? The risk of being exposed to coronavirus if you're elderly puts you at risk. So we know that we've had cases in nursing homes and that we want to slow that down. So we've worked every day with nursing home folks to make sure that they test and make sure that they isolate, make sure that they have a wing of COVID away from folks that are not exposed to COVID. And we got through most of the nursing homes, and we had a few left that aren't quite there. So yesterday we sent out a letter from the department that it is required, that they have to do the testing or there may be sanctions. Medicaid sanctions. So that is our effort, after working real hard with them, to make sure that everybody is doing the right thing for those vulnerable citizens. And so in the nursing homes, where once COVID gets in there, it spreads rapidly and there's worse outcome, it's critical that we stay on top of this virus by not having people visit, by testing to see who has it and who doesn't. So these are all critical steps to protect that part of our society. Again, to reiterate what's being said by the governor and by Dr. Bu, we are in the summer when everybody was hoping this virus would slow down. And it doesn't. If you don't do what you're supposed to do to protect yourself and others, it's not slowing down. It may stay a little slower than what we saw in the spring, but if it hangs around to the fall and we don't take this virus seriously, we'll see a spike in the fall and we'll see flu in the fall, and it'll look very similar to what we saw in the spring, if not worse. So it's up to us to slow this thing down and stop the spread. So we have doubled down on our efforts with nursing homes to make sure that we can stop the spread in those congregate settings.
Can you say what the Medicaid sanctions would be to hold back some of the funding that they're
So there are sanctions that we could use as far as not letting them have new admits. They won't have new patients. There are sanctions we can do as penalties, civil penalties, and there's sanctions we can do by withholding payment. So there's several sanctions that we can look at if they don't want to work with us. I do think they will work with us. I do think that it's a hard, difficult question to answer. How often should you test? And how are you going to keep this virus from spreading in folks that are very vulnerable? And so we've required that they have baseline testing and then go back each week and test those that are negative as long as they have active COVID cases in that nursing home.
How often are you requiring them to go back and retest people?
Weekly for negative tests. So if you're positive, you know you're positive, you're not retesting those. But if you're negative and there's still COVID cases in the nursing home, they have to test their residents, people who live there, and their staff weekly until they have no cases for 14 days.
And is there any mandate on nursing homes of having the cases for 14 days?
Well, they still have to test, because if you have no cases, is that because you didn't test, or is that because there's no COVID? You still have to answer the question.
So what's the requirement at that point, once a week or something else?
Right now, you test until you show there's no positives, but you continue to test the staff weekly to show that they're not coming into the nursing home with COVID.
There were at least 22 nursing homes, I think was the last number I got that y'all are having trouble getting compliance from. Is there an updated number of how many?
That's the latest number. We have several that aren't at quite the requirements, so therefore we've given them till the end of the month, to June 30th. So there's a number of those. About a third of nursing homes don't meet the requirements. So that's the number. It's more than 22 when you look at not meeting total requirements, but there were 22 that weren't meeting any of the requirements. And I think that's going to change now that we've sent this letter out.
Good afternoon. I'm Karen Stubbs with the Louisiana Department of Health, Office of Behavioral Health. As expected, many people in Louisiana right now are experiencing high levels of stress and anxiety. We saw an influx of people seeking resources and emotional support early on in the response, and we anticipate as people begin to return to the community or faced with the choice of returning to the community, that we'll see it again. One of the reasons I'm here today is to offer a few reminders about some of our resources and introduce a new one. We have several strategies to support the emotional health of Louisiana communities in coping with these stressors, so I'm going to list a few today. Our newest resource is the Behavioral Health Outreach Line. This went live on Monday, June 15th. The number is 833-333-1132, and we'll make sure you get that number. This is for individuals. It provides real-time support in order to avoid, prevent, or intercept a crisis from occurring. This particular line has a little bit different focus than the existing line that I'll remind you about later on. This line offers recovery support, facilitated by trained specialists to assist persons in recovery of substance use, mental health, serious mental illness, or co-occurring disorders. And it has a focus on speaking with our healthcare professionals. However, let me say that those with no prior history of substance use or mental illness are absolutely welcome to use this line and take advantage of the services that it offers. Trained specialists and clinicians will answer the phone 24 hours a day, 7 days a week at no cost to the caller. Supportive warm lines are the term and the model that has proven effective, an effective resource for people with behavioral health disorders like mental illness, suicide concerns, and substance use disorders. And because of their associated increased risk factors, persons with substance use and substance use disorders or existing mental health challenges due to the increased levels of stress, anxiety, depression, and comorbid challenges, as well as the increased risk factors associated with our healthcare professionals, we thought it was extremely vital to mitigate potential relapses or threats to emotional stability. And that's why we focused this line on those populations. A call could range anywhere from someone just having a bad day who wanted to call and talk to someone anonymously, to maybe someone who's self-identified as having one of those warning signs of a mental or emotional change, maybe thoughts of suicide, and using this line in order to prevent relapse. That new line that went live this week, the recovery support line, is in addition to what we've talked about, our Keeping Calm Through COVID hotline. That line, and I'll remind you of the number 866-310-7977, which is also a 24/7 toll-free number, was opened March 15th in conjunction with the initial COVID response. That line also provides emotional support, crisis de-escalation, coping techniques for those struggling with the impact of disaster or experiencing anxiety or emotional distress. It is for the general public, and anyone can and should call. We've had to date over 3,000 callers call and use this line, and what's important about this line is that the people responding are also armed with the general information about COVID. What we're finding is a lot of the stress and anxiety is brought on by simply lack of information or misunderstandings or needing to talk to someone, and so they have all the general information about COVID and testing sites and things like that as well. For those people who prefer to text, we want to make sure to meet them where they are. And there's also a text line. You can text REACH OUT, all one word, REACHOUT, to 741-741. It does the same. It's a confidential support text line. I also want to talk about some literature and reading materials. We find a lot of parents and families really are in search of literature around how to cope with the stressors of being a parent and having a family during COVID. Our website with the Louisiana Department of Health has some behavioral health resources, and it includes things like helping children cope with stress, talking to your children who are isolated, and caring for children in a disaster. These are also great materials during hurricane season as well. And then lastly, I want to remind people that if you have a current mental health or substance use provider, you really need to stay connected to that provider. There have been many telehealth flexibilities that are currently allowed during this response, and we just encourage you to maintain that connection to your existing provider if you have one.
Do you have questions for Karen?
This support is available in Spanish?
Yes, ma'am. In fact, it's available in the question was, is the support line available in Spanish? Yes, it's available in multiple languages.
Just wanted to come back and add one more clarification, especially with the question about bars. I do think we saw in the media some misunderstanding around the availability of live entertainment, especially live music, in Phase 2. And just to clarify, live music and live entertainment are not in Phase 2. I think the confusion arose because we are certainly welcoming people who want to present live entertainment to provide us with proposals on how they would keep their audiences and the entertainers themselves safe. Whether that's something that eventually ends up in Phase 2 or something that helps inform Phase 3, it's the same thing that we've done with Resilient Louisiana Task Force, trying to get information from the groups that have to operate under our phases so we understand how best to give them the best public health guidance and make these venues as safe as possible. But to clarify, live entertainment is not in Phase 2. Thank you.
Thank you, Karen and Alex and Jimmy, and we've been going for almost an hour, but I did want to come back and give you all an opportunity to ask some questions. Yes, sir, Sam?
Governor, based on the gating criteria you guys showed us, there are several places that seem pretty obviously unprepared to move into Phase 3 by the time you're scheduled to announce it. Does that mean the state is not moving to Phase 3, or are you considering moving region by region?
We'll make the announcement early next week. We will do it on the most recent data that we have as we work through the weekend. We did want to give you all a glimpse of what several regions, well, really what the whole state looks like, but obviously there are several regions that are particularly concerning, and those are 4, 5, and 6. But we're not going to preempt today the announcement that we're going to make on Monday. And quite frankly, we don't yet have the data, the final data upon which we will make the decision. Yes, ma'am.
In terms of masks, you obviously have been encouraging people, and obviously a lot of people don't wear them, including in this building level below us. I'm wondering if you thought about making masks mandatory, like some other states have done, or is that still off the table?
You know, I'm not going to tell you that we haven't thought about it, but at the end of the day, those states that went there quickly reverse course. It's just not something that you can enforce, and I think you end up doing more harm than good by trying to make it mandatory. But we are trying to appeal to people and their sense of compassion and responsibility for self and neighbor. We're trying to give them the facts about this disease and how easily it spreads and how serious it is in terms of the health consequences, especially for those who are most vulnerable. And so knowing, and in fact, the case for wearing a mask today is much stronger than it was back when CDC first made the recommendation, because now we know that the majority of transmission happened because of particles, airborne particles, and aerosol that come because people are speaking, coughing, sneezing, and breathing. And that's why the mask is so important. And by the way, there's certain settings that are more conducive to the spread, because not just are you speaking more, you know, for example, if you're singing, and that's why we've seen those clusters develop in places like choir practice, where you have people in close proximity and they're singing. But as you empty your lungs, you also then take a very deep breath in return. And that gets back to the live entertainment situation that we're talking about. And, you know, that's just one of the things we have to take into consideration. But that's why the mask is so important. And we're just going to continue to appeal to people, and hopefully they will understand. Nobody wants to go backwards and start imposing more restrictions. And we shouldn't need to do that if people would do what we're asking. And it's not just wearing masks. It is washing hands. It's staying home when you're sick. It's keeping 6 feet apart. But your point is well taken. There are a lot of people here in this building who are not setting a very good example. Yes?
Governor, if you compare our data to some of the data belonging to our neighboring states, in the Gulf South we have the lowest positive of most of our neighbors, and we're testing more people per capita than most of our neighbors. Should that matter?
Well, it matters because we're doing everything that we can, and we take every bit of information that we have into consideration when we make our decisions. We have tested now a significant part of our population. Our monthly testing goal is, as I mentioned earlier, 4.3%, 200,000 tests. Unless something very strange happens, we're going to greatly exceed that. But at the end of the day, the virus is still very much in control. The reason we test is so that we can concentrate our efforts where they need to be, inform our contact tracing and so forth. And so the more you know, the better. You know, it's actually been suggested by some, well, if we just stopped testing, people wouldn't worry because they wouldn't know there were cases. No, there are going to be cases. You just don't know that they're there. And then you can do almost nothing to try to address the situation. So, and I will tell you, the Department of Health, working with all of our academic institutions and hospitals and healthcare clinics and with our federal partners and the National Guard and GOSEP, have done a tremendous job of really ramping up our capacity to test. And again, it's not, we don't just have a plan to test X percentage of Louisiana's population. We want to test a percentage of every parish's population. And we want to get into those congregate settings, and we want to be able to go to where we have hotspots and so forth. And so they have a very comprehensive testing plan that, as you now know, includes mandatory testing in nursing homes. And obviously we had worked with the nursing homes for a long time. The vast majority of them did what we were asking of them a long time ago, and now we've taken this final step. But at the end of the day, I don't expect or want to have to use any Medicaid sanctions or anything like that. And we believe we're going to get compliance on the testing. Leo?
Given the graphs that we just saw and you just mentioned about the restrictions before and the spiking around the country as well, is there a figure or a percentage that maybe Dr. B would come up with that might cause you to want to regress back into restrictions of phase 1?
Well, I don't think we need him to come up and tell you what I'm about to tell you. First of all, we're not there yet, even with the data we're seeing in terms of putting more restrictions on. The question is whether on the 26th of June we do something other than stay in phase 2. Now, the biggest concern that I have as governor is that we put ourselves on a course to where we could outstrip our capacity to deliver health care in our hospitals. And so that's what we want to avoid at all costs. We're nowhere near that. And so I could probably, engage in a discussion with you for a very long time, but we're just not there. The question is whether we, on the data that we have and the gating criteria that we're using that was provided to us by the White House Coronavirus Task Force, the CDC vetted gating criteria, whether we can move forward with fewer restrictions. And at some point we're going to get there. The question is whether we get there on the 26th. We don't yet have the final data that we're going to use to make that determination. And as I mentioned to Sam a while ago, I'm just not going to go there today. But obviously there are circumstances that could theoretically happen both here in Louisiana and elsewhere around the country that would cause us to put more restrictions back in place. I don't see that at the present.
Last one.
That might have been the last one. Well, thank all of you. Obviously, I hope that the information that was provided today, specifically in regions 4, 5, and 6, but elsewhere, to some degree, will get people's attention, and people will understand that we're very much still in the middle of this, and we have some work to do. But as Dr. B, you mentioned, when you see the work that we've already done, there's no doubt that people of Louisiana know how to do it. And it should be a lot easier because we're not at the apex right now. It should be easier, but we just need more compliance from folks. And I always have confidence in the goodness and the decency of the people of Louisiana, and I know they want to be good neighbors, and so I anticipate that they will do better. And in the meantime, I'm going to ask individuals out there to do your part. We all have a role to play. And if you intend to go somewhere and you get there and it just doesn't look safe, don't go in. That by itself will send a signal to the proprietor that they need to make sure people are distancing and wearing masks and so forth, and it'll do the community a lot of good, and certainly it'll do good for you and for your family. So I anticipate we will have another press conference next week on Wednesday, or
maybe Monday to
oh yeah, that's right. I'm trying. So we will do it earlier next week, and the question will be whether we come back in behind that with another press conference later in the week. Anyway, thank you all very much, and I will see you then.
Governor John Bel Edwards with his weekly update on the coronavirus. He had no new numbers from the CDC on coronavirus cases through no fault of his own. Those numbers just weren't made available today. He did report, unfortunately, though, that there are 7 new deaths in the state of Louisiana, and that brings the death toll in Louisiana to 2,957. He reminds everyone that just because more places are open, that doesn't mean you have to go to those places, and there's a reason he gave us that reminder. That's because the numbers over the last few days would indicate that there has been an increase, and this isn't an increase because we're seeing more testing. In other words, a data dump. These are actual numbers and an actual increase, according to Dr. Bilyeu. And that, of course, reminds us not to become complacent. And I think that was the overall message from Governor John Bel Edwards. They also want to help people who are struggling with mental issues, mental health issues, and they've given out a number to recovery hotline. This would be recovery support for those dealing with substance issues, and that number is 833-333-1132. Also for general support dealing with stress, or if you just have questions, you can text reach out, all one word, to 741-741. And for the very latest, just go to brproud.com. We're going to return you now to your regular programming.